Cystic fibrosis is a multi-system genetic disorder that predominantly causes infections of the lungs and chronic respiratory failure, but really impacts all sorts of other organs in the body, including the pancreas, the GI tract, the liver. And the science in cystic fibrosis has evolved dramatically in the last decade or so. Now there are oral therapies available to treat some of the underlying genetic variants. These therapies are called CFTR modulators. They're basically protein therapies that, depending on what your underlying genetics are, can correct the protein defects and really transform the lives of somebody with CF. What's also been fascinating is with the availability of these therapies here in the United States, we have learned a lot about different aspects of care. One of these aspects is pregnancy, where many of these people, now that they're living longer and healthier lives, are really thinking about expanding their families and having children. Fortunately, we have not seen any sort of increased adverse signal by these babies seeing these medications. There has also been another group of people who are found to be a carrier with one variant of the CFTR mutation, but don't have CF themselves, and are found to have a baby with CF who've asked, what if I take this medication and my baby with CF sees it? Will my baby in utero have a benefit from these medications? And there have now been actual case reports in that setting where those babies who are exposed to those medications in utero, as well as the moms with CF whose babies potentially have CF, can actually benefit from these and are born without some of the traditional complications of cystic fibrosis.